Then the second point was just that exactly what you just said. Among heavier women, we observed a peak increase of 19% on average at 24 hours.
Instead of 14% in the
Right.
overall group.
Correct. And it remained significantly elevated during the 2 weeks. We also, when we stratified for weight, there was a statistically significant increase of 11% at 24 hours for the fresh group juice.
Okay, so the fresh juice had more effect on the heavier women.
We could see it.
Yeah.
Because
Okay.
again, remember that our population was 17 or 16,
Small.
17.
Right, right. We don't have a
numbers.
lot of women. Right, got it. Okay.
For estrone, like estrone sulfate, we observed a greater percent change in E1 values among participants with a higher BMI.
Okay.
Among heavier women, we observed an increase of 12% on
Okay.
average at 5 days. And at 2 weeks, we observed a 17% increase.
And that makes sense because estrone is the estrogen, and then estrone sulfate is just adding a sulfate to it. So it's a variant. They're variants of each other, and they can switch back and forth between each other. So you saw the similar effect in both of them, and they're both what you would expect to be higher in postmenopausal women.
And again, with the fresh juice, in heavier women, we were able to observe a statistically significant increase.
Interesting. So really an interaction between the two.
And that we couldn't see when we had all of the women
Together. Yeah.
For estradiol, we found no consistent effect of grapefruit intake on circulating levels.
But estradiol is less common in postmenopausal women.
Well, and it's also, it's very low.
Yeah.
And it's hard to measure.
Right.
By using 2 baseline blood samples, we could quantify the normal variation in hormone levels in the absence of the intervention.
Right.
And we found that the change in estradiol during the washout period was, in fact, considerable. And given that variability and the fact that women postmenopausal have low circulating levels,
you didn't see much effect.
Well, it would require a sample size of 85 to detect a statistically significant difference.
So there's too many different levels of estradiol in these women, so they really couldn't see it muddied the grapefruit effect. So they need a bigger study in order to really see it. That's the translation.
Right. Now, I left this chart in because I thought it was an interesting. This is where we measured the acute effect. And prior to this time, we've been talking about the chronic effect, and the first measurement that we showed was for 24 hours. This shows the mean estrone sulfate concentration during the first 24. And this is for 10 women who were the participants who agreed to come into our lab and give us allow us to draw blood specimens at 1 hour, 2 hours, 4 hours, 8, 10, and 24 hours after ingestion.
What great army of women volunteers.
Yeah. So participants ingested a half a grapefruit after their baseline blood draw, and you can see that the hormone level actually starts increasing immediately.
Yep.
And at 8 hours, the increase in estrone sulfate ranged from 10 to 41%.
Wow.
And interesting, what I think is so compelling about this particular chart is that in all 10 women, the hormones went up.
And remember, these women aren't taking hormones. This is just the effect of the grapefruit on their own hormones that their own bodies are making. So just imagine if you, in addition, were taking other additional hormones, it might be even worse.
And what's interesting is that the effect is immediate. You see it at 8 hours, and that's where the peak occurs.
Gee, and I love grapefruit. Oh, well.
So what's the significance of these findings? Well, in postmenopausal women, estrogens are biosynthesized in peripheral tissues, such as fat tissue, skin, and muscle through conversion of circulating inactive steroids.
The ovaries make the precursors, and they're turned into estrogen in all the peripheral organs. And so estrone sulfate's one of the main precursors, as inactive precursors, as are some of the other testosterone actually and androstenedione, and then and we know that elevated hormone levels increase breast cancer risk. it's still a little bit of a leap to say that if you don't eat grapefruits, you'll reduce your risk of breast cancer. So I think that the whole story, it's a really interesting story about how you go from looking at fiber and then go from looking at fiber decreasing breast cancer to looking at how grapefruits within the fiber were the most important thing, and then going forward, and 2 studies saying maybe not so much, and then going forward and saying, well, let's give women grapefruits and see if it affects estrogen. And lo and behold, it does affect it. And now we're going to have to do another study, a big study.
Right.
A big study that really looks at whether, and are you going to give them grapefruit?
Yes.
And so then you'll compare the women who you have eat grapefruit to the women who don't eat grapefruit to see who ends up getting breast cancer. And that's the answer to one of our questions, saying, does this mean that eating grapefruit or any product with grapefruit is going to increase breast cancer? And the answer is, we don't know yet. Hang on. You can be part of the study that proves it one way or the other. But at this point, we've got some, incriminating evidence, but we still don't have proof. And so I wouldn't completely throw out the grapefruit.
Well, basically you just... Yeah.
I'm sorry, I took away your summary. Go ahead.
More study of grapefruit, but I also put in parentheses, other fruits and vegetables containing furanocoumarins is needed. This area of research is clearly important for breast cancer prevention.
Right.
It's something that Dr. Love mentioned earlier, that you can just stop eating it and perhaps reduce incidence. But this also may be relevant in breast cancer treatment, as grapefruit is thought of as a healthy food,
right.
and it is not uncommon for patients to change their diet after diagnosis.
And we often tell people to eat high in fruits and vegetables. The irony is, I wonder if women who eat grapefruits have less hot flashes. Because they have because they have more hormone levels. So when you do your big study, you should also look at that may be the flip side of it.
Right.
That if you're really suffering a lot from hot flashes and you're not at high risk for breast cancer, maybe you should try eating more grapefruit to reduce your risk.
Right. And I put the very last bullet point in. We need to determine a safe level of intake. More than anything, when after we've done this research, that's the question I'm getting the most frequently, is, well, how much can I eat? And the answer right now is we don't know.
Yeah. But I think that certainly anybody who's having, eating a mixed, a salad or mixed fruit, and it has two little things of grapefruit in it, shouldn't worry that they're doomed or they're going to drop dead of breast cancer. It's not so simple as that. But I think in general, if you're at high risk for breast cancer, and certainly if you're taking hormones, you might want to be a little more cautious and not be a grapefruit a day kind of person, because it certainly does look like there's going to be some link here. And it's interesting because it may also, the grapefruit story could also be relevant to other fruits and vegetables.
Exactly.
Either that they might increase or they could decrease.
Right.
I mean, what if instead of making the enzyme work better, it made the enzyme work worse so that you didn't convert it and then maybe you'd have a decreased risk?
Right.
So we have one question about lemons. Now, we did say limes, but I don't think you said lemons.
I didn't say lemons, and because at least to date,
right,
and there has been a lot of research, is that they have not. Remember before when I talked about the one slide, I said furanocoumarins are a class of chemical compounds, and so lemons do not have the same effect as grapefruit.
So lemons are okay. Limes, you should be a little careful.
We're not sure about limes.
We're not sure yet about limes.
Right.
Okay. But, people don't usually eat that much in terms of limes.
Right.
All right. So we won't, and fresh juice, but not the pasteurized juices. So pasteurized juices are okay.
Well, actually, the fresh juice that's found in the refrigerated section, that's actually flash pasteurized.
Okay.
So it's pasteurized to very, very, very quickly so that it doesn't break down a lot of the components and the flavor stays.
Right.
And we're seeing some evidence, at least in heavier women, that there might be an effect for women that consume fresh juice. But anyway, more.
So, okay, so here's something. Somebody said if you're in menopause and you don't do hormones, can you still eat grapefruits? Well, I have a question. So if you're skinny and you're in menopause, the people who are really thin tend to have more hot flashes than the heavier people. And so maybe we can let the thin people have grapefruit and not the heavier people. What do you think about that? We don't know.
We don't know. I mean, we saw the effect for whole grapefruit in all women.
Right.
There was a bigger effect among
if you were heavier.
But
yeah.
It doesn't mean that the thin women didn't have an effect. It just wasn't as great as the effect that we observed in heavier women.
Okay. So
and actually, the other thing that's really important is that when we presented these results, we're presenting averages.
Right.
And this is a small study. For the whole grapefruit group, there were only 17 women in it. The range was anywhere between maybe a 4% to 75% change in hormone levels. And yes, BMI was part of the one of the factors that affected it.
Right.
But there have to be other factors that affect it as well.
Right.
And
so if we do a bigger study, then maybe we can figure out why some people manage to eat. Maybe there's another enzyme that has to do with how the grapefruit is broken down to make it affect the enzyme that is how the estrogen is broken down, or something like that.
Yeah.
So the answer, folks, is not never eat another grapefruit again.
It's moderation.
It's moderation, and if you're at high risk for breast cancer or overweight, you would want to be more cautious maybe than people who are lower risk and are thin. But we really don't know, and I think the most important thing about this study is it's a good example of what's behind the headlines in the media. The media will say, never eat grapefruit again, or grapefruits cause breast cancer, or something like that. It's much more complicated than that, and science takes a number of steps. We go from the original hypothesis of fiber to, oh, look at, maybe it's the grapefruit, to, oh, can grapefruit actually do that in people, to, and does it actually do that in people, which we haven't done that study yet. But stay tuned, because when she gets funding and when we design it, we will recruit in the army of women and we'll answer this question, and someday you will know whether you can eat grapefruit.
I want to just show my last slide.
Go right ahead.
Oh, the study contributors. Dr. Malcolm Pike, he's my co-investigator and mentor for many, many years.
And a friend of mine.
Yeah. Carla Soriano, project manager. She was fabulous. Dr. Basing, she's at the USC School of Pharmacy. Dr. Frank Stanzik and Elizabeth Gensen, they're the ones that run our assays for us. Diana Chingos, a friend. She's a patient advocate and consultant. She's helped me with very good advice. Obviously, the love